Correct moving and positioning are fundamental pillars of providing dignified and safe adult care. When we assist someone to move, whether it is from a bed to a chair or simply to adjust their position, we are undertaking a task that carries significant responsibility. The primary reason this is so important is to protect the person we are supporting from injury. Incorrect techniques can lead to falls, skin tears, pressure sores, or even more severe harm. For the individual, these injuries can cause immense pain, distress, a loss of confidence, and can set back overall health and well-being. It is our duty as care workers to ensure every movement is a positive and safe experience. Beyond immediate physical safety, proper moving and handling techniques are crucial for maintaining dignity and promoting independence. Using the right approach empowers people to participate in movement, which helps maintain muscle tone, preserve joint flexibility, and support overall functional ability. Safe moving is also about protecting you, the care worker. The physical demands are significant and bring a risk of musculoskeletal injuries, especially back injuries. Repeated incorrect lifting puts cumulative strain on your body, chronic pain, time off work, even career-ending injury. Ultimately, safe moving and positioning is non-negotiable. It embodies person-centered care and puts safety, comfort, and dignity at the heart of every action, creating trust and security for residents and staff. In the United Kingdom, a clear legal framework exists to govern safe moving and handling practices. The primary piece of legislation is the Health and Safety at Work, etc. Act 1974. More specifically, the Manual Handling Operations Regulations. 1992 require employers to avoid hazardous manual handling where reasonably practicable. If a task cannot be avoided, employers must assess the risks and reduce them. Your employer must provide training, safe systems of work, appropriate equipment. Alongside these laws, national guidelines give practical detail. The Care Quality Commission expects robust policies on safe moving and handling. NICE provides evidence-based recommendations on areas like pressure ulcer prevention and falls. As a care worker, you have responsibilities. Take reasonable care of your own health and safety and of others who may be affected. Follow the training you've been given and use the equipment provided correctly. Read and understand the individual's care plan before any move. Never attempt a move you are not trained for or that feels unsafe. Report issues like faulty equipment or changes in a person's mobility to your supervisor immediately. Ultimate accountability lies with your employer. Employers must ensure suitable and sufficient risk assessments for each individual. Provide the right equipment, maintain it properly, and deliver adequate training. If incidents arise from systemic failures, the employer holds primary accountability. If a worker knowingly ignores training or the care plan, that individual may also be held accountable. A basic understanding of anatomy and physiology is essential for moving people safely. The spine is a key area of concern. Vertebrae, discs, nerves. It is strong but vulnerable to damage from awkward twisting and stooping motions. When lifting, use the strong muscles in your legs, not the weaker muscles in your back. Protect your spine. For the person you are supporting, understand their joint skin can be very fragile, especially in older adults' muscles. Know their limits. Joints may be stiff and painful. Move slowly and gently within a comfortable range. Certain health conditions can affect safe moving. Arthritis, moving joints too quickly or too far can cause severe pain. Stroke, weakness or paralysis on one side needs specific support. Dementia, the person may be distressed or resistant, risk increases. Each condition needs a tailored approach. The individual's care plan from a thorough assessment is your primary guide. If you identify a risk, act immediately. Frayed strap on a hoist, slippery floor, sudden change in a person's condition, dizziness or feeling unwell. Stop what you're doing. Do not proceed with an unsafe move. Make the immediate situation safe for the person and yourself. Report the risk immediately to your line manager or person in charge. A wide range of aids and equipment is available to make moving and handling safer. It is absolutely essential that you are trained and deemed competent before using any equipment with a person. One of the most challenging situations you may face is when a person's wishes conflict with their care plan. An individual has the right to refuse care, and this must be respected, provided they have the mental capacity to make that decision. If a person refuses a move that is outlined in their care plan, you should not force them. Instead, stop and try to understand their reasons. Pain-frightened wish to do things differently, gently explain the risks of not moving, such as developing pressure sores. If they still refuse, you must document their decision and your actions clearly. Report the situation to your supervisor immediately so a review can take place. Knowing when to ask for help is a sign of a safe and competent care worker, not a weakness. Seek help if you are unsure, if the person's needs have changed, or the move requires more assistance than planned. If equipment is unfamiliar, or you feel physically unable to perform the task safely, stop and ask for training or assistance. Never take a chance. Continuous learning is vital, and regular refresher training is a legal requirement. Use trusted sources: Royal College of Nursing, Skills for Care, Health and Safety Executive, and professional publications.